And this is where I like when you talk about one of the, of course, the pillars of lifestyle medicine. It's nutrition, talking about the whole food plant-based, whole food, predominantly plant-based diet. And that is the key. And somehow, which often, I'm sure you would have been asked, is it a veganism? Is it this? And which somehow, when you put into veganism, it's like, oh no, there are certain people, a certain philosophy to that kind of avoid everything completely. But with the lifestyle medicine, of course, yes, of course, we care for animals and other things, but primarily we are physicians, we are doctors. So
evidence-based.
Evidence-based doctors. And so it's not, there is a room for change.
Yes.
And we take a patient from where they are, if they are ready to change. I was actually curious on readiness of change. What comes, I was thinking all these things as we're talking about this, because the challenge that we have, evidence is there, Jenny. It's not that there is no science. The science is there. And even when you talk to the patients, they can say, oh yeah, this is true. In fact, if you remember when you're talking about hypertension, you know, the what is this? Even our medical school, we still have the DASH diet for hypertension. Is it?
DASH.
DASH, yes.
Dietary approaches to stop hypertension.
Yeah, now, even that diet, I mean, it's important to note that actually, I forgot his name, the guy who was on the head of the committee who came up with that diet. It's not that he didn't know that the animal protein actually has a direct effect on high blood pressure. But then they were trying to find certain acceptable to the community. That's where they add a little bit of fish. Yeah. Otherwise, so there is this thing is, if you remove everything, then no one is gonna eat it.
And it's about nudging people on that spectrum.
The spectrum. So, now, my question is then it comes to even the DASH diet, because people not actually doing that. How do you bring them to that? Of course, they have to be ready. But what have you seen before they become ready? How do you, not to coerce them, but how do we speak to them and show them the gravity of the disease to their own health and their family's health, so they can come to the realization, I need to change? How do you come to the readiness part?
So I think it's also important to find out what their intrinsic motivator is.
Yes.
To talk to them and say what motivates them to make changes, to improve their daily choices so that they can prevent or treat or reverse or improve their health parameters.
Yeah.
So I think it's a very individualized approach. So first, the readiness to change.
Yeah.
And then to maybe share information with them. So, you collaborate with your patient and you go through, let's say, their biomarkers, their blood results or their cardiovascular risk factors, and you personalize it to their situation and also to find out what their life, everything, all those pillars of lifestyle.
What their goals are in life.
Sleep, and to go through everything. The intrinsic motivator, I think, is very key to knowing, what will encourage them to make the necessary changes, to make better choices every day. But it is very complex because they're different cultures, they're different traditions, they're different. People have the accessibility to healthy food can be challenging for some people. There can be a lack of interest or a lack of awareness, or a lot of my patients, they understand. We do this empowerment session where we teach them about adding in more whole plant foods. It's my approach to nutrition, for example. It's about adding to every meal rather, and then crowding out the ultra processed foods and working together to take, let's say, their basic breakfast and how we can optimize that to adding in more whole plant foods. But it's a process, and it's a step by step. And again, it's about showing up consistently rather than striving for this perfection.
Definitely.
But I think establishing the patient's intrinsic motivator, whether it's being energetic enough to play with their grandchildren, or being able to walk their daughter down the aisle at her wedding, or whether it's just having more energy during the day, or whether it's entering a fun run and managing to run 5 kilometers. It's so individualized for each patient. And I think helping someone establish what that is already half the battle won, because then you've got their buy-in and they want this. And I think that's important.
No, that's very true. I like your answer. And also just, I mean, even our experience, I mean, we did not all start that way. And it's more your why, like trying to find something that
exactly
the why. And often I do speak to the patients, and I say, look, I try to bring all the factors, not really to coerce them, but to, like you say, putting out their blood results and see how, you know, if we don't do this, this is what is likely to happen. And we don't have to go that route if we can do small changes.
Because we are taught that fear cannot be a motivator. That's the problem. It is not a good motivator. It's not a lasting motivator.
It's not lasting,
So, you know, it is important to find out what each person's individual intrinsic motivator is. So I think that's definitely part of my lifestyle consultation approach. And then empowering people. I think that's what's so important. Guide them, help them understand the power of food as medicine, you know, and sleep medicine, and, you know, stress coping mechanisms. I remember as a newly qualified doctor just feeling so poorly equipped to know how to help someone manage their stress. I didn't have the tools in my tool set other than a pen to paper approach and prescribing a benzodiazepine, or you know, a hypnotic for sleep disorders, or you know, there wasn't it wasn't I didn't have a good foundational approach to every presenting complaint. So that's, I think, where my training in lifestyle medicine, it truly is foundational healthcare to which you build.
Of course.
And pharmaceuticals still have a place, but my approach is, let's try the lowest effective dose. If someone needs a prescription, let's correct the foundational health as much as we can, and then build from there.